My name is Dr. Andrew Fanous. I am a neurosurgeon at Innova. I am the medical director for spine surgery at Innova's Eastern region, and I am the section chief of neurosurgery at Innova Alexandria Hospital. Today, we are discussing SI joint dysfunction, which is a very near and dear topic to my heart because it's an often overlooked cause of severe axial low back pain in many patients. So a sacroiliac joint is a joint that connects the ilium, which is part of the pelvis, to the sacrum, which is part of the spine. It's usually stabilized by ligaments and muscles. So if you look at the literature, between 15 and 30% of patients with severe axial low back pain have the SI joint as the origin of their pain. Patients with sacroiliitis or SI joint dysfunction complain of severe low back pain. The pain can also radiate into the legs and can cause leg weakness or numbness, and can also go into the groin. But the most common presenting symptom is severe axial low back pain.
I'm Madeline. I was put on prednisone for Crohn's, and that caused necrosis in my bones. I had 2 hip replacements. After recovery, I started doing personal training. I felt great. I was just having a normal day, and out of nowhere, I felt just kind of a soreness, pain in my lower back, and it got much stronger. The pain was just so unbearable. It hurt to lay down, to move, to turn, to do anything. My life was stripped away from me. I couldn't visit my friends or family. I couldn't leave my bed. I couldn't drive. I couldn't do anything for myself. So at this point, I needed help.
So when I see a patient who's coming to my clinic with severe low back pain, we first take history from him or her. We ask them what causes their pain and what relieves it. And after taking a thorough history, we examine the patient. The first thing we ask the patient is to point to the source of their pain, and we want to make sure that they have a positive Fortin sign. After that, we perform the 5 provocative maneuvers. Those maneuvers involve applying pressure to the SI joint to make sure that this is provoking and reproducing the pain. If the patient has 3 or more of those provocative maneuvers being positive, the next step is to send them for diagnostic injections. And if the patient experiences significant pain relief following the injection, then we confirm the diagnosis of SI joint dysfunction. Once a patient is diagnosed with SI joint dysfunction, the treatment options include non-operative management, including pain management, physical therapy, or wearing an SI joint belt, injections with steroids, or ablations of the nerves within the SI joint. Patients who do not experience long-lasting relief of their pain from non-operative management are good candidates for SI joint fusion surgery. The iFuse torque procedure is a minimally invasive procedure aimed at fusing the SI joint. It's performed by placing 3 implants across the SI joint. The implants are 3D printed, and they have a surface topography similar to cancellous bone of the ilium and the sacrum, which facilitates bone growth into the implants. The procedure is performed through a small incision, about 2 centimeters in length, over the buttock, and it takes approximately 1 hour. Patients tend to go home on the same day, so it's an outpatient procedure.
I had my iFuse procedure a year ago. I felt instant relief. This surgery changed my life.
After the procedure, I usually recommend that my patients are partial weight bearing for approximately 2 weeks after surgery.
I had to use either a walker or cane and not put weight on one side of my body. I started Pilates again. I thought I would never be able to get back into working out, and here I am, stronger than ever. I can drive my car again. I can cook again. I have my life back and more.
So if you're a patient with severe low back pain and you would like to be evaluated to see if the SI joint is the cause of your symptoms, you can call the number at the end of this video to come in for a consultation.